Yeah, hi everyone. My name is Dr. Nadine Hachach-Haram. I'm a consultant plastic surgeon at Guy's and St. Thomas's. I am the Director of Innovation and Strategic and Industry Partnerships. I'm also the co-managing partner of KHP Ventures. So what that means is I'm really at the nexus of kind of academia, healthcare, innovation, and private capital. So my role is part clinical in my day-to-day job as a plastic surgeon, but I also work with the leadership team to really think about how we reimagine better, faster, fairer healthcare for the future. And that involves a number of activities across our innovation and transformation arm, working with our strategic boards like our robotics board and our surgical councils and other committees to help think about how we take surgery to the next level, but also helping enthuse and invest in great ideas that are coming out of our organization. And so KHP Ventures is the first real NHS venture arm, and we are investing in small companies that are spinning out of our organization or spinning in to create value across digital and medtech as well. I'm very fortunate in the roles I described myself. I'm also a clinical entrepreneur myself. So as much as I'm involved in the strategy and how we think about things, I'm also an operator per se. So I founded and set up my own company a few years ago now called Proximie. And Proximie is a software platform that enables us to really digitize the operating room and cath labs. So what it means is that it helps you simply by using your phone or tablet or computer, you can virtually scrub in to those environments to learn, to share best practices, to capture information and knowledge and make it more accessible to others down the line. And we've used it to really help drive education and training with King's College London medical students, with certain specialties, pan-London, pan-deanery as well. And we've also been using it to help drive new techniques in areas of robotic surgery and interventional procedures in orthopedic surgery as well. So it's a great software because it really enables you to have a front row seat at what goes on in an operating room. And even more so, we're now starting to use it to think about beyond the procedure itself, how can we make the operating room a more data-driven environment? How can we use it to better understand the ethnography of the operating room, how efficient we can be, setup time, turn down time, instruments that are being used. And we have partnerships across all clinical specialties that are deploying and using it. And anyone who's interested in learning more about it or wants to see how they can use it for training or education or any other use cases, please reach out to us and we'll be more than happy to help. I'd love to describe my sort of aims both at a surgical level with my day-to-day kind of job, but also at a more strategic level. So I believe clinically, we have a really important time now to think about how we drive the effectiveness of surgery for the future. How do we deliver more surgery with less for the patients that need it whilst maintaining quality? And we know today in surgery, we have a high amount of variability. We've seen all the GIRFT reports. We know that there's challenges and variations across different systems. And so being able to kind of codify surgery is really important to me. The second is really being able to lean into the education side, because as you all know from the hashtag, no training today, no surgeons tomorrow. We really have to think about surgical teams, nurses, scrub techs, and others. How do we make sure that we're building the right workforce to continue to deliver surgery of quality and at scale for the future? And I believe the King's Health Partners with their academic surgical board and their community can play a big role in partnering with us to do that. The second bit, I think, which is also exciting for me, is that working at Guy's and St. Thomas's, but also across the King's Health Partners, is that we are very unique when you think across the country. We are probably one of the biggest health systems and combined partner trusts. We have one of the most diverse patient populations, of huge variation in socioeconomic and ethnic diversity of capabilities. And we have an opportunity and a responsibility to really reimagine what is going to be the best model of care for this population. And there's no better environment to do this than in Southeast London. I'm really proud to be working there. And I think we have to really start to lean into technology and innovation, process and device innovation, and think about what the future of healthcare will look like. I'm incredibly proud of being part of King's Health Partners because the co-location of some huge healthcare organizations, as well as one of the country's leading universities, enables us to really bring healthcare and innovation together but also academia. And that trifecta, I think, is really, really meaningful. And now we've added on the further ingredient of private capital, which means we can really start to reshape and I think democratize access to healthcare within our own patient population, but hopefully over time use that as a flagship for what national systems should look like as well. And so looking across the board, whether it's how we approach clinical trials, how we approach data, how we approach IP, how we work with private-public partnership, and how we really think about creating more opportunities for people in our community is going to be really meaningful. So I'm very excited to be part of that and excited to be supporting a lot of my partners across the trusts in how they're trying to deliver specific projects that help us decentralize care in a really unique way.